I have just come from raising the flags outside of the City Hall, formally acknowledging the International Day Against Transphobia, Biphobia, and Homophobia. While we've come a long way, there are still residents of this city and people around the world who face discrimination, violence, and isolation, among other things, as a result of their sexual identity. As Mayor, I continue to work hard with my colleagues on City Council and the City staff to create a city where everyone is respected and embraced and is able to live a life of respect and dignity and inclusion and safety. And today we remind ourselves of that deeply held objective for our 2S LGBTQ+ communities and for all of the residents of the City of Toronto. Team Toronto has now distributed more than 1.73 million doses of COVID-19 vaccine in the City of Toronto alone. City-operated immunization clinics, together with the city's enhanced mobile operations teams, have now administered more than 400,000 doses of COVID-19 vaccine, and more than 659,000 appointments have been booked at city-run clinics. We're announcing today that more than 60% of eligible Toronto residents have now been vaccinated. Again, this is another significant threshold, but no reason to stand back and admire. We have much more work to do. We know that, but I do commend the teams, all of the teams, led by Chief Pegg and our health partners and our community partners and everybody else for getting as far as we have. I want to thank all of them. They are heroes in ensuring that we will be able to get through the pandemic and reopen safely, which we all want to do. And I want to say thank you as well to the 60.1% of eligible Toronto residents, a healthy majority, who have stepped forward to get their shot. I'd like to highlight three amazing examples of the Team Toronto effort. First, I'm pleased to share an update with you on accessibility-focused vaccination clinic held on May the 13th at the city-run clinic at the Metropolitan Toronto Convention Centre. The clinic was a partnership between the city's Accessibility Task Force on COVID-19 vaccines and Toronto Public Health, and it is the city's response to one of the task force's recommendations. This was the first of two such clinics serving people with disabilities. Approximately 600 people and their caregivers were vaccinated last week, and around 1,000 more people will be vaccinated this coming Wednesday. Each client's accommodation needs were met, including ASL interpreters, sighted guides, or professional attendants, among other requirements. Torontonians with all different types of differing abilities were welcomed and were provided with a safe and accessible venue to receive their vaccinations. Feedback from residents who attended the accessibility vaccine clinic was that they found it accessible and that they were appreciative. I want to thank all members of the Accessibility Task Force under the leadership of Chair Wendy Porch, Executive Director, Centre for Independent Living in Toronto, who worked with all the city teams to plan these clinics. And I want to say thank you as well to the following organizations who generously shared their staff on the day of the clinic: the March of Dimes, RENA, PACE, Silent Voice, and Balance for Blind Adults. And thank you as well to the incredible Toronto Public Health team. They have so many things they're doing so well, and they have been for a long, long time now, and I want to thank them very much, as well as our partners from Toronto Fire and EMS. The enthusiasm and the commitment of all of these people in the public domain made a critical difference in ensuring that people felt welcomed and that they were served with dignity. Second, on Saturday, I had the opportunity to visit the Punjabi Community Pop-Up COVID-19 Vaccine Clinic in Scarborough at the Gursikh Sabha, Canada. Consistent with Sikh values, which see that faith community in non-pandemic times serving meals to anyone that is hungry, anyone at all, 24/7 at their places of worship, they welcomed many members of their own faith on Saturday, but also welcomed to their place of worship residents from all corners of Scarborough. And it was my pleasure to meet them, those who were there to be vaccinated, and also to thank the wonderful doctors and staff, including nurses and other staff from the Scarborough Health Network who ran the clinic. Thirdly, I want to give out a huge shout out to the East York Health Partners, including in particular Michael Garron Hospital, who worked to vaccinate more than 10,000 people on Sunday at the Thorncliffe Park Community Hub in the East York Town Centre. What an incredible achievement by the Michael Garron team, who have been leaders throughout, and by the more than 10,000 people who actually came out to get vaccinated, and all of those who helped to make it happen. As a matter of interest, from the end of March to May the 16th, the vaccination rate among adults in Thorncliffe Park neighbourhood have gone from 16% to 57%. And that is still a work in progress, but it is a sign of huge progress that we've made as a result of a targeted team effort with all of those who've been mentioned today. It's great news that the province has announced that all residents 18 and older will be eligible to book a vaccination appointment starting tomorrow at 8 o'clock in the morning. In about 2 months, and even with limited vaccine supply, we've gone through all of the different age bands to get to this point where anyone of any age above 18 can book their appointment. We are committed to providing as many vaccine appointments as we can, and the more doses of vaccine that the government can provide, the more appointments we will be able to offer. I hope everyone is clear. The demand for appointments created by these welcome changes to eligibility can only be met through an increase in vaccine supply in the coming weeks. We do not book appointments for which there is no committed vaccine. As Chief Pegg will detail today, our city immunization clinics are almost fully booked for the next few weeks based on the predicted supply. We are working now with the province to secure additional vaccine supply so that we can open up more appointments to meet the increased demand in the coming weeks. I spoke to Premier Ford about this issue today because I believe it is so important that we have the vaccines that we need to get everyone vaccinated once every adult across our city becomes eligible as of tomorrow morning. And it was a very constructive conversation I had with the Premier. While I know it isn't easy, I encourage residents who are newly eligible tomorrow to look at every option. You can seek an appointment at a city-run clinic by going to toronto.ca/COVID-19. You can seek an appointment at a hospital or hospital-run clinic by going to vaccineto.ca. And you can find pharmacies offering appointments, increased numbers of pharmacies offering appointments through the province's website. Since summer camps are a hot topic right now, I did want to provide an update on the summer's city day camps. The city is planning on offering in-person and virtual Camp TO programming this summer, subject to the provincial regulations and public health guidance. The Premier offered a positive outlook on this yesterday, but we will await formal details from the Government of Ontario before finalizing our plans and sharing them with the public. The city would typically begin offering camps on July the 5th, so once we have clarity from the province and health officials, we will move forward with our objective being to keep to that schedule if we possibly can. With the warmer weather finally here, we are working with landlords to help them understand the rules regarding heat in apartment buildings. This comes up every year. While the heat bylaw states that landlords must provide heat to minimum air temperature of 21 degrees Celsius up to June 1st, we know that it can reach this on warm days without the heat on. This can make it uncomfortably warm for tenants. We ask landlords to please use their judgment and turn the heat off on warm spring days such as those that we're projected to have this week. Finally, speaking of warm spring days, all of us have to do better at keeping our parks clean of litter, including but not limited to Trinity Bellwoods Park. For our part, we have increased and will continue to increase litter collection efforts in parks, and we will be immediately installing more litter bins and garbage bins in the Trinity Bellwoods Park in particular. But those bins must be accompanied by park visitors doing the right thing by putting their garbage in or at the very least beside those bins. It is a partnership, and we are rightfully proud of our parks right across the city, and we all want to keep them looking their best throughout these prime months when we all hope to be using them on an increasing basis. Now it's time to ask Chief Pegg to offer his remarks for today.
Thank you, Mayor Tory, and good afternoon. To date, more than 1.7 million doses of COVID-19 vaccine have been administered in Toronto. Last week alone, 280,434 people received their first dose of vaccine in Toronto, 93,249 of which were in a city-operated vaccine clinic. This was the largest number of doses of vaccine administered on a weekly basis across the network of 9 city-operated clinics to date. We were able to administer this increased number of doses of vaccine as a result of additional vaccine being made available to us by the Province of Ontario. I would also like to acknowledge and congratulate our Team Toronto partners for successfully operating so many fantastic vaccine clinics last week and over the course of the weekend. This week, based on the present vaccine allocation, we will be able to administer slightly more than 65,000 doses of vaccine across the network of 9 city-operated vaccine clinics. The number of appointments that are made available in city-operated vaccine clinics directly corresponds with the quantity of vaccine made available to us by the province of Ontario. This represents approximately 1/3 of the vaccine being provided to the City of Toronto this week. The remaining 2/3 is being allocated to our Team Toronto partners, including hospitals and Ontario health teams. As of this morning, while our city-operated clinics are very close to being fully booked for a number of weeks, there are still some appointment times remaining available between today and June 13. For the remainder of this week, our clinics are 97% booked, with approximately 1,718 appointment slots remaining available as of this morning. For the week of May 24, our clinics are 97% booked, 97% booked for the week of May 31st, and 70% booked for the week of June 7th. Tomorrow at 8 a.m., the province of Ontario will expand vaccine eligibility to anyone who is 18 years of age or older. Available appointments in city-operated clinics can be booked via the provincial booking system by accessing toronto.ca/COVID-19 and clicking on the blue Book a Vaccine button on the top of the page, or by calling the provincial call centre at 1-833-943-3900. Should the province of Ontario make additional vaccine available to us for any of these periods of time, we are able to open additional appointments to match. We have both the capacity and ability to increase the number of appointments in our city-operated clinics by at least 30,000 doses per week, as soon as additional vaccine can be provided to us. I remind everyone that in addition to the vaccine opportunities in city-operated clinics, our hospital and Ontario health team partners are also administering vaccines each day. As Mayor Tory explained, please go to vaccineto.ca for opportunities that may exist across their network of clinics. Thank you for all you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. I will now invite Dr. de Villa to bring her report for the day.
Thank you, Chief Pegg, and good afternoon. Today, I'm reporting 1,837 new cases of COVID-19 over the last 3 days, averaging 612 new cases daily. 1,011 people are in hospital. 271 people are in the ICU. And I'm saddened to report 24 deaths over the last 3 days. Where COVID-19 is concerned, there is often a gap between appearance and reality. Today, I want to talk about the variants believed to have originated in India and which are increasingly making headlines all over the world, and rightly so. These variants are now present in about 40 countries, including ours. These new variants are raising a significant amount of worry in the United Kingdom, which today is almost fully reopening. Hotels, indoor dining, the pubs, all are opening again. Cases of the variant have doubled in the UK in a little more than a week, from roughly 500 to over 1,300. The government's scientific advisors there believe it is a realistic possibility the variant is as much as 50% more transmissible than B.1.1.7, which was first identified in the United Kingdom. Early information suggests there may be some reduction in protection given by vaccines or by naturally acquired immunity from past infection. But overall, it's still good news if you're vaccinated. It is something to think about if you're not. The World Health Organization has called it a global concern. And the last public reporting identified 36 cases in Ontario linked to these variants. Last February, as we anticipated the UK's B117 variant, I told you that the prospect of exponential growth had me as worried as I had ever been during the pandemic. Regretfully, the last few months unfolded as so many feared. I'm not predicting the emerging variants will do in Ontario what B117 is still doing. But I accept it's possible, and we should do all we can to prevent history from repeating itself. The infectious new variants are here, and we should act as individuals in that knowledge. As vaccinations increase, as we hear of opening up in other places, and as our weather improves, the temptation could be to get ahead of ourselves. At this point, I expect there will be more mixing between people in the coming weeks, especially given the warmer weather. In Toronto, we have people in 3 different situations. There's the fully vaccinated, a relatively small number of people who've received both doses of a 2-dose vaccine. Second, the partially vaccinated, the large and growing number of people who've received their first dose of a 2-dose regime. Their risk of infection is reduced. The ability to come through an infection with mild illness is greatly enhanced, but their capacity to continue to transmit the infection is not entirely eliminated. The partly vaccinated can still make other people sick. And this brings us to the third group, the unvaccinated. The mayor announced today that 60% of people 18 years and older in Toronto have received at least their first dose of vaccine. But when you consider the entire population of the city, which includes children under 12 who aren't eligible for vaccination, just over 50% of people have had a first dose. That's a considerable number of people still at risk, and they need to continue to practice the steps for self-protection. In any form, COVID-19 is nimble, and stories from around the world tell us that it isn't in full retreat. Every new infection is a new opportunity for COVID-19 to mutate. So it is the unvaccinated we need to think of in the next weeks and months, and that is the gap between appearance and reality that I'm speaking of today. Addressing the gap is a simple and familiar prescription. It's getting a vaccine as soon as you can, and the diligent practice of the steps for self-protection. Keep a safe distance from people you don't live with. Minimize unnecessary contact with people you don't live with. Spend as much time as you can outdoors. Be mindful of ventilation, and wear your mask when you can't keep a distance. These steps should be routine in the home stretch and should do the bulk of the heavy lifting as we head toward a new normal. The news out of the United States and the United Kingdom illustrates what a new normal looks like. And compared to the last year or so, I think we can all agree it looks really good and a lot like what we're used to. But we're not the United States or the United Kingdom yet. We can be if we keep taking those protective measures to limit spread while we build up our vaccinated population and our body's ability to prevail over the virus. I have a challenge for everyone today, beyond the steps for self-protection. More and more, we're asking everyone we talk to, have you been vaccinated yet? My challenge is, don't stop at asking. Move on to acting, especially now that almost everyone is eligible to sign up for a vaccination. People listen to people they know. People gain confidence from the experiences of people they trust. So act to encourage the unvaccinated to change that. Act to help people get a booking. Act to help them get comfortable with vaccination if they're hesitant. By stepping in to help and encourage and getting people talking and thinking, we can make as big a difference as we can by self-protecting. Because the more we drive the vaccination numbers higher, the better off we are sooner. With that, I'll now turn it over to Brad for the question period.
Thank you, Doctor. We'll go first to Matt Bingley from Global News. Just a reminder to please unmute yourselves. Matt, go ahead, please.
Hi there. Dr. de Villa, I'm just wondering, with the number of mass protests over the weekend, I know you were talking about variants and the fact that we're not out of the woods, but I'm just wondering if you have any concerns about viral spread in the crowds, and whether you would recommend anybody who is there if they should go get tested or not.
Well, you know, Matt, I would say this, and you'll have heard me say this many times before, certainly being in outdoor environments gives rise to lower risk for transmission, right? A bigger airspace and the ability for you know, dilution, if you will, of virus definitely reduces the risk of any spread of disease. But people being close together for an extended period of time, even if outdoors, does give rise to that opportunity for virus transmission. So, of course, I would encourage anyone who experiences symptoms of COVID-19 to make sure that they're getting tested. And, of course, I would encourage people to continue to follow the steps for self-protection, as I just said. You know, try not to, you know, interact with people outside of your household. Really try to keep your distance as much as possible. And if you're in a situation where that distance cannot be maintained, to wear a mask. Of course, I would encourage people to get vaccinated, and taken all together, these are the steps that together will get us to that situation where we all want to be, where we're starting to see things more like life was before there was a COVID-19.
Run beginning on Thursday. I'm just noting that last year, when it came to the Raptors, in a better situation last year at least, that people were able to watch from various outdoor venues in cars. I'm just wondering if the city is looking to make that happen this year for hockey, to try to avoid any rogue parties or people gathering indoors.
To be honest, we haven't finalized any plans in that regard in terms of city-sponsored events. I've been busy settling up with some terms for the Mayor of Montreal, because that's a historic rivalry that's going to take place, and it will have a lot of interest. And so I'll take that question as something that we should be taking a look at, whether it's for you know, this particular series or as we hopefully go further into the playoffs. But I think it's an appropriate question. We have made no arrangements of that kind as yet.
Okay, thank you. We'll go next to Francine Copin from the Toronto Star. Francine?
Oh, hi, good afternoon. My question is for Dr. de Villa. Dr. de Villa, I'm wondering if you could give us what detail you can about the Indian variant. You mentioned that there's 36 cases in Ontario and that it's more contagious than B117, which was more contagious than the original virus. I wondered if you could give listeners, and so we can give our readers more detail on this.
Sure, Francine. So I'll try to give you as much detail as I can. With respect to the number of cases in Ontario, what I mentioned in my remarks was that the last public reporting identified 36 cases in Ontario linked to the B1617 variants. And this was a couple of weeks ago now. Probably best to go to our provincial counterparts in respect of what the current case count is. And yes, we are still very much in the learning phase in respect of these new variants, the B1617 variant, and there are a couple of sub-variants that are being reported on. And the early data suggests that it is more transmissible. The extent to which it's more transmissible, again, still trying to really land that specific number, but certainly the early reports suggest that it could be as much as 50% more transmissible relative to B117. And you're quite right, Francine. B117 was more transmissible than the variant of COVID that we were dealing with last year. So these are still early data and still much learning happening in respect of the B1617 variant, and it's something that we're certainly keeping an eye on. That's not unique to Toronto. I think the entire global public health community is watching this particular variant very, very carefully, given what the WHO has already said and the experiences of countries around the world.
My second question is a follow-up question. How concerned are you that this Indian variant or other variants could drive a fourth wave? I mean, God forbid.
Well, I will join you in suggesting that we are all, hoping that this doesn't happen. But certainly it is a possibility, which is why I think it's important that we continue to be very vigilant around what steps are within our control. And first and foremost, that is going to be practicing those measures for self-protection. We know that works. We know that keeping distance and minimizing unnecessary contact and using masks and hand hygiene are important steps in terms of reducing transmission. But we also know that vaccine is another key component of our toolkit against COVID-19, including this new variant. So I would just encourage people to really continue to be vigilant about those measures for self-protection, to make sure that they're taking that opportunity to get vaccine as soon as that's possible. And that's really the best we can do at this point, aside from continuing to monitor at our level and at provincial and federal levels the development and the spread of this variant, so that we can inform each other based on the experiences around the world.
I thank you. We'll go next to Mark McAllister from City News. Go ahead, Mark.
Thank you, Brad. A question for perhaps Dr. de Villa and Chief Pegg, if possible. Doctor, you had made a point of saying it's time to address the gap. So this question is related to that somewhat. If we're looking at vaccination rates broken down by neighborhood in the city, it looks like there's been lots of success in getting into those hot spots and making some progress. But there are now other areas where some of those rates are low. How will you focus your efforts to make sure people in those specific areas now get their shots?
So, Mark, that's a great question, and it's exactly what the team that is behind the mobile and pop-up strategy is constantly focusing on. So there are a number of us that are following the vaccine coverage data for neighborhoods all around the city. That is what determines where best, or where the next efforts, or which areas of the city need to be concentrated on next. And that's what will continue to happen in the future as we monitor the data and see where vaccine uptake is good and where it's not as good. The vaccination efforts are then focused on those neighborhoods to ensure that we're getting vaccine coverage as high as possible in all neighborhoods across the city. And of course, this is not something that we do alone. It's not a Toronto Public Health or a City of Toronto undertaking by ourselves. We certainly have our healthcare partners who are absolutely key to this and have done much of the heavy lifting. You heard the mayor comment on the excellent efforts that have been put forth by many of our healthcare partners. But I would be remiss if I failed to mention our community partners as well. They are absolutely critical to this. They are the ones that tell us about what's happening in the community, where are the good locations to actually set up in specific neighborhoods, and they provide many of the connections and conduits that we need in order for those efforts to be successful. So it is absolutely a team approach across the entire city, and we'll continue to do that as it served us quite well.
If we were to look at perhaps a couple of the areas we're talking about, and I don't know if you have an explanation necessarily, but I'll use Willowdale East as an example. Here's a part of the city that you would look at and think there's really no explanation one way or the other, at least at first glance. There's actually a city-run clinic right in the heart of that part of the city. How is it possible that these parts of the city, their rates are in and around 35, 36%?
So Mark, you're quite right. I may not have the specific answer for any one given neighborhood. But, you know, it's sometimes a number of different factors, right? So we've just heard today that eligibility is opening up to a broader swath of the population, going down to 18 years of age. So those neighborhoods that perhaps are not quite as hot or labeled as hotspots and are generally younger may have not had the same opportunity to take up vaccine as other neighborhoods have. But certainly I can tell you that we're constantly monitoring the data. We will observe where vaccine uptake needs to be improved and make sure that we're adjusting our efforts in order that we don't leave any neighborhood behind. We want everyone in the city to have the opportunity to get access to vaccine as their eligibility comes up. As we know that this is an absolutely crucial part of our efforts to get to the other side of this pandemic and restore life more like it was before there was such a thing as COVID-19.
Okay, thank you. We'll go next to Scott Lightfoot from CTV News. Go ahead, Scott.
Thanks, Brad. I wanted to ask a question about enforcement. There was warning from Toronto Police on Friday that they'd have dedicated teams out and about this weekend. Wondering if we could get some indication about what kind of enforcement was done, maybe how many tickets or charges, and any particular areas that were targeted or focused on.
Ask Inspector Matt Moyer from the Toronto Police Service, who's on the line to answer that question for you. Inspector?
Hi, good afternoon, Scott. So this past weekend, Scott, I'm just going to give you the quick summary of all 3 days, 14th, 15th, and 16th. We had dedicated teams from all 16 divisions, and in total, they looked into 327 large gathering calls and laid 177 charges. And I can tell you just like from the layout of the enforcement piece, it was pretty well spread. There was maybe a few more extra charges laid in the downtown core because we had a couple of situations in the downtown core that required a little extra enforcement piece to it. So, but primarily that was such as the Cherry Beach. There was a Cherry Beach event that we had to go to, which took up 8 or 9 charges as well. So, but that's our numbers for the weekend.
Thanks. And a question for maybe the mayor or Chief Pegg. I just wanted to ask about the challenges of enforcement. I mean, obviously it's been long and difficult lockdown. It's been 6 months now here in Toronto. You've got medical officials suggesting people get outside, that things are safer outside. The weather's getting better. You have a long weekend coming up. But on the flip side, I mean, you still have this stay-at-home order in effect. Is there a sort of a common sense approach people should be taking in order to, I guess, abide by the law, but also, you know, do things that are safe for their mental and physical health?
Good afternoon, Scott. So I think you've actually partially answered your own question. It is complex and it's complicated, and I fully appreciate, as does our entire coordinated enforcement team, that the lockdown has been long, COVID-19 has been long, and people are tired and frustrated, and we're all longing for this to be over. Inspector Moyer well detailed the challenges that are faced out and about from a coordinated enforcement standpoint, and really it relies upon the expertise of that coordinated enforcement team, including police, Toronto Public Health, and municipal licensing and standards folks, who are looking at each situation or each complaint in their context and are exercising their best judgment. With respect to what all of us can do, I think Dr. de Villa and our public health colleagues have been very clear. Being outdoors is great. It's great for mental health. It's great for physical exercise, and certainly we're all encouraged to do that. But the advice and guidance that Dr. de Villa and team have continued to provide as recently as today is maintain physical distancing, and where that can't happen, best to continue to wear a mask to prevent the spread of COVID-19. So we're all really happy to see the nice weather here and to be able to be increasingly outdoors, and that coinciding or corresponding with very significant amounts of vaccine being administered. I believe that every single day that goes by, we're getting closer and closer to having COVID behind us. Mayor Tory?
I would just simply say that on the weekend I got, as is our want or our like for jobs like we have, I got equal numbers of calls from people who were saying there's too much enforcement and those who were saying there was too little enforcement. And I think in the end of the day, what was made reference to, which was common sense, concern for the common good and a common concern we all have for public health should be what dictate as few of these kinds of events as possible. And then it wouldn't be necessary for us to deploy 300 and some odd times people out to investigate large gatherings. It would be better if we just had none of those just for a while yet, and then we'll be in a position where everybody will be well, the pandemic will be behind us, and we can get back to having a good time, whether it's on a beach or in a park or anywhere else. But I think common sense would be a good way to sort of look at this as opposed to any particular effort we can or can't make with respect to enforcement.
All right, thank you. We'll go next to Natalie Johnson from CTV News. Natalie?
Hi, everyone. My first question is to Chief Pegg. I know that you said that you only have as many appointments as you do vaccines. When the province opens the eligibility to people 18 and up tomorrow, in Toronto, how far out will most people be booking at this point? I know you said you have small numbers available, like 1,700 appointments this week, but when those floodgates open, is it looking like the bulk of those people will be booking well into June or maybe even later?
Hi, Natalie. At present, the appointments that are live in the system, meaning that they're able to be booked in city-operated clinics, are from today out through up to and including June the 13th. So that's the range of appointments. The bulk of the available appointments, like I said, there are still appointments available for this week and a handful of appointments over the next 2 weeks. The bulk of the remaining appointments, at about 30% or so, was for the week of June the 6th. At this point in time, appointments have not been open past June the 13th. You of course are aware that we are a client of the provincial booking system, and therefore it is ultimately the province of Ontario that manages that booking system and authorizes the opening of additional appointment blocks. So those are regular ongoing discussions that we are having with our provincial colleagues literally every day, both from the immunization task force side and through Dr. de Villa on the public health side. And we look forward to being able to open additional appointment blocks and additional appointment volume the very moment that additional vaccine can be made available.
Thanks. And just as a follow-up, how much worse off is Toronto in terms of vaccine supply now that the province has ended its allocation based on hotspots? Or is that mitigated by the overall increase in vaccine supply, even when distributed on a per capita basis?
I'll start. Dr. de Villa may wish to add. From a city-operated clinic perspective, the last 2 weeks, we received additional vaccine as part of the hotspot strategy, which allowed us to increase our clinic operations by, I'm going off memory here, but about 30%. And that was as a result of an overall approximate 30% increase in the amount of vaccine that was made available citywide. Of course, beginning today, that additional vaccine no longer exists. That's why in my remarks you heard me reference that our clinic operations, where last week we were capable of vaccinating about 98,000 people across our network of clinics last week. This week, at present vaccine allocations, that's about 65,000 vaccines this week. Again, I'll say again, if and when additional vaccine can be made available to the province and then subsequently to us, we can, in very short order, expand our clinic operations and make additional appointments available. Dr. de Villa, I'm not sure if there's anything you wish to add.
Well, I think the chief covered it very nicely. Certainly there is not as much as there this week as there was in the previous weeks when we got the enhanced supply. But I would say this: one, there are ongoing discussions happening all the time with the province, and as you've heard the mayor mention in his remarks today, he has certainly taken the opportunity, as do I, to discuss with the province, how we would benefit here in Toronto from additional supply of vaccine. Given our particular circumstances here in Toronto, we've had lots of COVID-19 activity, and the more we are able to bring vaccines to the people of Toronto, the sooner we will be able, as an entire province, to put COVID-19 behind us. I think the other important thing to note is that we are seeing the province make use of an increasing number of channels for vaccine availability, which includes pharmacies and primary care, and certainly by having those partners increase their capacity and participate actively as vaccine partners, I expect that we will be able to provide opportunities for the residents of Toronto to get vaccine through as many channels as is possible, and that's a good thing.
Thank you. We'll go next to Greg Ross from CBC News. Greg?
Hey, my first question is about a story from yesterday. A Barrow restaurant on King Street West. Police say they broke up a gathering of more than 20 people there yesterday. They issued 9 tickets. I wanted to get a reaction from that, and I just wanted to know if we have any statistics that can suggest how many cases can be traced to these types of gatherings.
Greg, I'm going to ask Carlton Grant, the Executive Director of Municipal Licensing and Standards, who's on the line to answer your question. Carlton?
Thanks, Brad. So the Barrow restaurant is on King Street West. It is something that our staff, as well as public health staff, were at over the weekend, that we continue to look at. I can say that we have issued charges where people are, if a establishment is open and operating. The number of cases that come from these is probably more appropriately answered by Dr. de Villa. And I don't think we go down to that level of granularity.
Yeah, at this point, I wouldn't have any information to offer. It does take some time before people actually develop symptoms and then presumably go and get tested. I would suggest this, though, again, to the extent that people are able to really keep their distance and not participate in that kind of activity, particularly indoors where we know the transmission risk is higher, the better off we will all be. I don't think there's any question whatsoever that the entire city would like to put COVID-19 behind us and start to move on to life more like it was before. We are seeing this in many, many other jurisdictions. I mentioned some of them in my remarks this afternoon. And our ability to get there rests on each and every one of us doing our very best. One, to keep transmission low by practicing those measures for self-protection, and 2, by getting vaccine as soon as you're able to do so. The more we are able to engage in those actions, the sooner we would be able to find ourselves in a situation where we can enjoy those kinds of activities and that kind of togetherness as we used to before there was a COVID-19.
Okay, my follow-up is just that the owners of that restaurant issued a statement just basically saying that it was only staff that were there at the time. And the reason they were there is because they're preparing to reopen and they're launching a new menu, and the staff needed to be there to be familiarized with the menu, but they said they did it on their rooftop patio, yet they were still issued tickets. I'm wondering, with many restaurants in a position right now where they're preparing to potentially reopen in the coming weeks, if this is something that is okay for staff to be together in a situation like this, preparing for that opening, or is there suggestions on how this should be done, or is this simply something they can't do at this time?
Dr. de Villa?
Well, I can certainly give a try, and we'll see whether Carlton has anything further he wishes to add. I would say this. Look, there's existing legislation and there are existing regulations governing how businesses should operate. And I recognize that people may want to prepare, and in fact a number of restaurants are continuing to operate and to provide takeout or pickup or delivery service. And there are certain safeties and measures or regulations that are in place in order to ensure that that is done in as safe a manner as is possible. I would encourage people to follow those rules because it's important. That is part and parcel of what we can do, at least in the business community, in order to get us to that place that I just spoke of, where COVID-19 is behind us, where we're more able to enjoy life as it was before there was a COVID-19. So I would encourage people to inform themselves, to ensure that they're following the available rules, because the rules are there to protect all of us and to help get us to the other side of this pandemic sooner rather than later.
Greg, I'm not sure if Carlton has anything to add, bearing in mind that they are charged with enforcing the regulations that Dr. de Villa alluded to. Carlton, anything to add?
I don't think so. I mean, this is a learning point for us all. If businesses if it's considered a staff meeting, but that is not what our officers found on site. It was, people eating and drinking on a patio, which sounds to me more than a staff meeting trying to get ready to get back up and running. So it's something that we'll take into consideration as we move forward, as we come across situations like this, and expand our line of questioning.
Thank you, Carlton.
Thanks.
Final question is to Derek Dionarain from CBC News. Derek?
Thanks, Brad. So first question, just in regards to a statement that Mayor Tory issued over the weekend in regards to video of an assault. There's new video that appears to show the victim in the attack had brandished a knife and bat or club of some kind in the moments leading up to those events. There's some concerns that politicians may have jumped to conclusions about the motivations of the assault, which police say they're still looking into. Mayor Tory, do you have any responses to whether your comments about the video specifically maybe were premature or might have served to paint an otherwise peaceful protest in a negative light?
Well, first of all, I respect the right of people to protest on this or any other issue. I do have some regret at the fact that some of these protests take place at a time when there are public health guidelines that would suggest they shouldn't. But having said that, I'm also very thankful for the fact that the two big protests that took place in Toronto this past weekend were both very peaceful. And I thank the participants in the protests and the police for the fact that they were kept peaceful. Now, there was the one widely publicized incident, which the police are investigating, which included some violence. And I will just say, first of all, that the videos that I was sent by people, I've sent them all along to the police. And my own comment said that, violence against anybody, whether it was motivated by anti-Semitism or by against any other group, was unacceptable. And I stand by those comments, which is that anywhere, anytime, no matter what the protest is, no matter what side you're on, that violence in the City of Toronto is not acceptable. And I stand by that, and I think that, that we'll all await the results of the police investigation, because they're uniquely positioned to take a look at all the videos and talk to all the witnesses and reach a conclusion as to what happened.
Thanks. And just to switch gears here a little bit, my apologies if this was already answered, but Ontario is getting double the expected amount of Pfizer doses this week. How exactly is that going to impact Toronto's vaccination plans for this week? And will you guys be making more vaccine appointments available based on the new shipment?
Hi, Derek. So at present, we have opened from a city-operated clinic perspective. We're opening it's about 65,000 vaccine appointments that are available in our clinics this week. That's about 1/3 of the total allocation that has come into the City of Toronto, the remaining 2/3 being provided to our Team Toronto partners, including hospitals, community agencies, and Ontario health teams. As Dr. de Villa has indicated, and I can speak from the immunization task force perspective, we are literally in conversations every day with our provincial colleagues with respect to vaccine allocation. Obviously, any news and any indication that there is increased availability forthcoming or on the way is very welcome news. And we're certainly in a position where immediately upon becoming aware of additional vaccine being made available to the city, we're prepared to react and respond and pivot to that and open additional capacity, both city-operated and partner-operated. So we'll await the outcomes of those discussions with the city. My apologies, with the province.
All right, Chief, thank you very much, and thank you all for joining us. That concludes today's briefing. Our next scheduled briefing will be this Wednesday, May the 19th. Stay safe.